when irritability dominates, laser is typically favored. Laser works so well biochemically. It's comfortable. In my case, it's also hands-free. So the workflow is there. In other words, I can either treat another part of the body or go treat another patient while that patient. So in other words, it's an unattended therapy in some cases. Very broad spectrum types of pain, which typically means, you know, what's causing that is multisystematic. And so, again, laser can address multiple tissues at the same time. The interface drivers, as we talked about, with like, tendons, ligaments, muscle tissue, especially if there is a mechanical problem, a mechanical type of application tends to work well. Now, there's the combined effect. And so we did a webinar on this in July of 2025. So you can go check that. And we don't have a ton. We've got some literature, and that's kind of cool for some of us that have maybe been doing this a long time, and to see maybe that we're not just crazy, and we're seeing the positive aspects come out in the evidence too. But maybe there's also an opportunity to combine some of these things if maybe there's two things going on. So there might be a lower level of irritability. I mean, think about that chronic low back pain patient that comes in, or even the knee OA, which is obviously also a chronic condition. Do I really want to just get after them with a mechanical form of energy, or maybe I need to potentially address the biochemical aspect and or apply the mechanical? The other thing to consider is, again, what these things can do for you. So laser's been shown to increase ultimate tensile strength of tissue, ligaments, even before we start mechanically loading them. So it's a really, really good precursor even before we start doing some of that mechanical stuff. So looking at the tolerance and also the stimulus that we want to deliver, and again, relative to these anchors, which could include the irritability along with some of these load tolerances. And then it's the painter in me, the artist, that says sometimes I want to be more aggressive. And that may be dictated by the type of patient, what they do for a living, whatever their capacity. I live in an area where a lot of people come up and they're on vacation. And so sometimes it's about getting them through so they can at least enjoy the rest of their vacation um, before they head back home.